quick topic here that's pretty popular on the web, adrenal fatigue. And you can do a lot of Googling and find a lot of different opinions here, from quick miracle drinks to people believing that it doesn't even exist. So why adrenal fatigue doesn't exist, it's actually a bad terminology. In school, we're trained in kind of the ends of the spectrum. Where the adrenal glands stop working is Addison's disease, and that's where you need basically steroids to live on. And then the other end of that spectrum is a hyper or too much production of cortisol, Cushing syndrome, because that's usually caused by us giving people too many steroids that can cause a bunch of symptoms. And so there's these both ends of the spectrum. And then when it comes to the middle, there's no training in medical school or PA school about anything in the middle of that spectrum. And so the term adrenal fatigue is also a misnomer for another reason, in that the adrenal glands don't really get fatigued. It looks like they do when we do labs on people that are under a lot of stress or a lot of medical conditions. These cortisol levels, free cortisol levels in the saliva will look really bad. But when an endocrinologist would do an ACTH stimulation test, the output of the adrenal glands is fine. So it's not that the adrenal glands stop producing or they get fatigued. That's why if you want to turn off your medical provider really quickly or your endocrinologist really quickly, start talking about adrenal fatigue. This is a common terminology, and this is what it's been used for years, but it's really bad. It's not medical terminology. So throw it out. We'll talk here in just a second. So a little bit more about that. Here's what the endocrinologists had to say about it, and this is somewhat recent when they made this statement. Adrenal fatigue is not a real medical condition. So very, very blatant about what their views are on adrenal fatigue. So don't talk about this term. Now, what's really happening is hypothalamic pituitary adrenal dysfunction. And so here's a little picture here that shows you why, when we see an adrenal output issue, it's really a brain issue. It's not really an adrenal issue, but the adrenal glands are just an easy way to check and see kind of where this HPA axis stands. And so here's the hypothalamus at the top, the anterior pituitary right over here, where hormones get secreted from the hypothalamus to then tell the anterior pituitary, and there's hormones back here too that it talks about a little bit, but that's not part of what we're talking about. The anterior pituitary secretes all kind of hormones into the bloodstream that affect not just the adrenal glands. It affects gonads and ovaries, growth hormone, bones and muscles, prolactin in the mammary glands, and then TSH, thyroid. So oftentimes, almost always, when there's a bad adrenal issue, there's also going to be hormone imbalances. There's going to be thyroid's going to be low output, and this will be another reason why someone would have low thyroid function besides an autoimmune attack like Hashimoto's. And so what's really happening is an HPA dysfunction where the feedback mechanisms are kind of broken. They're not working well, and they can be fixed. It's not a fatigue of the adrenal glands. It's an output issue. It's not an output issue. It's a feedback issue. And so here's just another quick chart on HPA is adrenals, kind of on the left side over here. On the right side is HPT. This is your thyroid, hypothalamic pituitary thyroid axis. Both of these start in the brain. Both are affected by stress, not just emotional stress. That does matter, psychological stress. But this can be a bug in your belly causing chronic infection, trauma, chronic back pain, chronic leg pain. Any of those things can cause chronic stress on the body. Chronic allergies are not a small thing, so that's something you definitely want to be on top of. Exposure, xenobiotics, things we're exposed to in our environment. So the most common things that are going to trigger this are things that cause inflammation and things that cause oxidative stress. And there will be a crossover effect. Adrenals will get wacky, and then thyroid will get wacky. There'll be an inhibition of the TSA. So the body will push T4 down to reverse T3, and your thyroid will get low, and you'll have a lot of symptoms of low thyroid. If you get treated for a low thyroid issue and you get your numbers optimized, your doc gets your numbers perfect, your TSH is right around the 1 or maybe even a little less, and your free T3s 3.5 or so, but you still have low thyroid symptoms, that's typically because it's a deeper issue. It's an adrenal issue. It's an HPA issue. And so it's then it's getting someone to be your detective, functional medicine practitioner, to look deeper with some lab testing here. So anyway, quick overview why adrenal fatigue doesn't exist. It does, it's just the wrong term. It's not adrenal fatigue, it's a hypothalamic pituitary issue. It's a feedback issue. So drop the word adrenal fatigue, try to get that out of your vocabulary, and thanks for tuning in. Have a great day. Bye.